In 1918, the United States stood at a moment of hope. The First World War was nearing its end. Factories were booming, families dreamed of prosperity and peace. But within months, a silent enemy spread across the nation. Streets emptied, schools closed, entire cities fell quiet. This was the influenza pandemic of 1918, a crisis that reshaped public health, changed daily life, and tested the resilience of the American people. The year 1918 was a time of transition for the nation. Millions of soldiers were deployed overseas. At home, citizens supported the war effort by working in factories, conserving food, and buying war bonds. Crowded military camps and busy train stations became part of everyday life. These crowded conditions, though necessary for wartime mobilization, created the perfect environment for disease to spread. Influenza was not new. Seasonal flu outbreaks had occurred before. But the strain that emerged in 1918 was unusually contagious and spread with alarming speed. In early 1918, reports of severe flu-like illness appeared in military camps. Soldiers experienced fever, fatigue, and respiratory distress. Many recovered quickly. But later waves of the disease proved far more dangerous. As troops traveled between continents, the virus traveled with them. Within months, outbreaks appeared in major American cities. By the autumn of 1918, the pandemic reached its most devastating phase. Cities across the country took emergency measures. In Philadelphia, a large public parade was held despite warnings from health officials. Within days, hospitals were overwhelmed. Medical staff struggled to care for the sick. In New York City, authorities implemented staggered business hours to reduce crowding in subways. Schools remained open, but strict health inspections were enforced. In San Francisco, residents were required to wear face masks in public. Posters urged citizens to protect one another by following safety rules. Across the nation, theaters closed. Church services were canceled. Public gatherings were banned. The sound of daily life faded. For ordinary Americans, the pandemic transformed daily routines. Families cared for sick relatives at home. Neighbors delivered food to doorsteps. Volunteers sewed masks and assisted hospitals. Imagine a mother in a small Midwestern town writing in her diary, "The streets are so quiet. The school bell does not ring. We keep the children inside and pray this sickness passes." Such reflections, though reconstructed from historical accounts, capture the fear and uncertainty felt across communities. Healthcare workers faced enormous pressure. With many doctors serving in the war, nurses and volunteers became the backbone of care. They worked long hours, often risking their own health. Local governments introduced measures that feel familiar today: quarantine rules, mask mandates, and public health campaigns. Posters warned citizens to avoid crowds, cover coughs, and maintain cleanliness. Newspapers published daily updates, urging calm and cooperation. While some people complied, others resisted restrictions, frustrated by closures and economic hardship. The tension between public safety and personal freedom became a defining challenge. The pandemic disrupted the American economy. Factories slowed production as workers fell ill. Shops closed due to staff shortages. Farmers struggled to harvest crops. For many families, the loss of income created lasting hardship. The promise of prosperity, often called the American dream, felt distant. Children missed months of school. Community events vanished. Weddings were postponed. Funerals were small and hurried, conducted under strict health rules. Several factors contributed to the rapid spread of the 1918 influenza. Crowded military camps and troop movements, urban overcrowding in rapidly growing cities, limited medical knowledge about viruses, lack of vaccines or effective treatments. At the time, scientists did not yet understand influenza viruses. Public health strategies relied on observation and basic hygiene rather than modern medicine. By the end of the pandemic, an estimated 675,000 Americans had lost their lives. Globally, the death toll reached tens of millions. Yet statistics tell only part of the story. Behind each number was a family, a workplace, a community forever changed. Entire neighborhoods mourned together. Churches rang bells in remembrance. The shared experience created a sense of collective grief and resilience. By 1919, the pandemic began to subside. Cities reopened. Schools welcomed students back. Public gatherings slowly resumed. The crisis left a lasting impact on public health policy. Governments invested more in health departments, disease monitoring, and medical research. Hospitals expanded. Training programs for nurses grew. Public health campaigns became a permanent part of civic life. The 1918 influenza pandemic reminds us how quickly life can change. It shows the importance of science, cooperation, and community care during times of crisis. It also reveals the resilience of ordinary people, neighbors helping neighbors, workers adapting to hardship, families finding strength in uncertainty. When the flu swept across America in 1918, it did more than close businesses and silence streets. It challenged a nation's sense of security and reshaped its future. Yet from that silence emerged lessons in compassion, public health, and shared responsibility. History does not only record tragedy, it also preserves the courage of those who endured, and the hope that communities can rebuild, even after the quietest and darkest days.